Hey, hello. Yes, we're live. Hi, guys. Welcome back to the channel. I'm Dr. Sylvia. So good to have you with me tonight. And I hope you can hear me okay. Let me just do a quick sound check. But if you're watching live and you're in the comment section, and you can hear me, please say hello. Let me know where you're watching from. But let me do a quick sound check so that I'm just not speaking to myself for the next for the next hour. That can be very, very straining. Okay, so how have you been? For the next. Oh, yes, we are. Okay, I can hear myself. Fantastic. How have you been? How was your week? And are you getting into the September, the Ember vibe? Are you coming out of summer? How is it all going? So my name is Dr. Sylvia. I am a general practitioner or consultant in general practice. I'm based in the United Kingdom. And this is AskAwayHealth. We love discussing things around women's sexual health, but of course it extends to our family health. And to be honest with you, many things under the health atmosphere. So if you've got questions, please feel free to share them in the comment section. Please free to post them. Of course, tonight we're doing a Q&A specifically looking at heavy periods, and I'm going to be tackling some comments that I've received from viewers. And I literally just got one a few minutes ago. I'll see if we can add it in. But yes, if you've also got comments while you're watching or questions while you're watching, put them in the description box, in the comment section. I will say though, and I will have to leave this disclaimer up for a few minutes, that while I encourage questions, I am not going to provide medical advice to anybody here, because this platform is not suitable for that purpose. I am not licensed to do that. I'm not your registered medical practitioner, and we're not able to get all the information that we need to be able to make any kind of reasonable, safe, sensible guidance. So for all those reasons, we will be providing general information that can just help to signpost you. You can go back and sit down with your doctor to discuss issues. That's the purpose for the conversation that we're having. So without all that said, welcome. Tonight is a practical session that we're having. I'll explain to you why. But as I usually like to do, let me just share with you what we've been doing on the channel for the last week or so. And before I do that, welcome friends from Facebook and LinkedIn. I'm still getting used to it. I think I'm doing a bit better. I've been used to doing live streams on YouTube for ages, and incorporating Facebook and LinkedIn. I'm still trying to get my head used to having a bigger audience on those including those two platforms. So you're welcome. We also have a couple of polls, or a poll and a question, running on YouTube. And if you want to be part of my polls and questions, then come over to YouTube and join and watch from YouTube. So the poll question relates to what you think is the average volume of menstrual blood that a healthy lady of childbearing age would lose over her menstrual flow each day. So average, I'm using average as 5 days. I know women can have shorter, longer flows, but let's just so that we don't go into too many deep tunnels, let's stick to an average of 5 days. How much menstrual blood do you think women lose per day? What are your thoughts? Let me know. Share your thoughts in the poll. Let's see what kind of numbers we come up with. There's a question around, I think the question is around what was the greatest impact that heavy periods ever had? Was it on your trying to get people around you to understand, for example, friends or family, or people that you work with, your employers, to understand how the struggle with heavy periods? Or was it with your healthcare practitioner, your doctors or nurses or whoever was looking after you? Or was it issues to do with making a diagnosis and treatment? What were the biggest challenges? Just having a conversation. And the topic for the title for this stream, I tagged on at the bottom, are doctors not doing enough? And I put that in for a special reason, simply because somebody made that reference. And I really wanted to I wanted to address that. And it would be lovely if people want to share their thoughts and comments. Let us be respectful. Discussion is fine. Even not agreeing with me, of course, is fine. We can't all agree. But I think we should be factual, honest, and as much as possible respectful. So let me share the screen and let's see what has happened in the on the channel for the last couple of days. So yes, in the last week since my last live stream, which was, I can't even remember, just literally 7 days ago, and I can't remember. Oh, we're busting pregnancy myths from around the world. Now that is a really, I would recommend, I know it's my channel, but I would recommend that video. And I did have a really interesting time looking at some of the different ideas and beliefs that people have. And I think something that was really instructive is the fact that, of course, the world is a global village, and you can't say that only one part of the world has this particular belief. It's all being exported and imported from here and there. So really, you will find a lot of beliefs that perhaps had their origin somewhere, but they're quite commonplace in different parts of the world. Worth watching that video. It was quite interesting exploring them. But during the week, we've talked about perimenopause, a very short video where I was just looking at some symptoms of perimenopause. And just to give you guys a heads up, I'm thinking about what we're going to do for Menopause Awareness Month coming up soon, next month, obviously. And what topics that we really want to dive deep into. I feel that we should really talk about perimenopause, continue the conversation, of course, around menopause, but also talk about perimenopause, because we still get comments from women indicating how much of a struggle this phase of life is, especially not understanding or not being aware that such a thing was going to happen, and so on. So there's still questions. I think we should really dive deep into them. Please, if you have any questions around that area, you can start sharing them with me, either in the community post sections. I think I will probably put something together pretty soon saying that we're going to be doing some videos in that regard, and I might get some of my colleagues to pop in and then join the stream, join either a live video or a an edited video. I'm not sure yet, but yes, if you've got any questions around that area, please share with me so that we can look at addressing them. So that was a short video on perimenopause, and we looked at fibroids, foods and fibroids, always a very popular topic. And I'm planning to do another one a little bit longer, simply to address, what is it about foods and fibroids? It can be a bit controversial. Did I say a bit? It can be a lot controversial. So let's have a conversation about what it is, especially as people, for many different reasons and which are respected, do not wish to go down the route of hormones or modern medical treatments like surgery or even surgical alternatives. And people are looking at measures that are natural, where there is no change to any, there's no physical, making any physical change to the body like you would do in surgery, or you're not taking any drugs that would in some way affect your natural rhythm, or things like that, as people believe hormone-based medicines do. So people want to go the natural way, and diet is one of those ways that people are thinking can or could affect fibroids. What are your thoughts? Anyway, I shared some of my opinions here in this video about foods that can or potentially harm or help you if you're on the fibroids journey, trying to manage symptoms and so on. So again, another short video, please check it out. It'll be great to hear from you what your own personal experience has been. Have you embarked on a period of time when you thought you're going to go down the very natural, healthy route, cut out sugar, cut out processed foods, cut out all manner of things that we say, and then what effect did it have on both your symptoms and fibroids? It would be lovely to hear from you. And most recently, the latest video was three days ago. Yeah, we talked about a thickened womb lining. I really go in a deep dive about this subject because it was a question from somebody not too long ago. And I initially shared some thoughts around it, but I decided to go back and really look at some of the issues, not just the causes, but what's the potential impact on things like being able to get pregnant, or what is the potential impact on your periods, or potential impact on your sex life, and then a bit about treatment. So again, well worth watching. It is about 12 minutes, but I promise you every minute spent is worth your time. So that is what we've been doing on the those are the videos that we've been publishing recently on the channel. And with that said, I'm going to get into the topic. Let me just take a quick break and I will be right back with you. Hi, I'm Dr. Sylvia. I'm so excited you're here. In this video, you'll get excellent health tips that will make a real difference. But that's not all. I also create personalized guides, tools, and plans tailored to your specific needs. These resources will help you reach your goals faster and more effectively. Don't miss out on your free copies. Check out the links in the description box below. Before you watch this video, please like and subscribe to the channel so we can continue this health journey together. So, let's get started. I'll see you in the rest of the video. Hi. Yes. Hi, Dr. Sylvia. Okay. All right, guys. So we're talking about heavy periods, and I have a couple of videos on the channel, and I will put the link in the description box below. I'm not so much going to be saying, well, this is the cause or possible cause. I've done that. I think that one is called 16 causes, probably more, but I looked at 16 causes of heavy periods. But I really wanted to address this particular conversation by looking at questions that have come into my channel, but actually based on that video, 16 causes of heavy periods. So let's begin. And if you're coming into the stream and you find this interesting or useful, please give it a like. I would really appreciate that. Where is my like banner? I usually put it, yeah, so let me at least let that be on for a few seconds of the video. Please give the video a like and share it with a friend, share it with somebody who you think might find it useful. And of course, consider subscribing to the channel. Come and join the family. Come and join our AskAwayHealth family. You will be very much welcome. Okay, so let us start with, which question should we start with? Which one? Okay, let's start with that one. So, I'll leave that on the screen for people to sort of read along and while I read it out. So this is a question from somebody. So let me read it now. Okay. They say, I have small blood clots during my periods and a very big clot at the end of my periods, bigger than the clot in the thumbnail. I will show you a clot. Just let me finish reading the question. Then they said, I have very heavy periods and pain on all the days of the periods that I have to take 12 painkillers in 4 days. I had an ultrasound which said PCOD, which is polycystic ovary disease, and enlarged ovaries, which is implied by polycystic ovary disease. And then they said I was on birth control for 3 months and the pain didn't go away. When I came off birth control, the birth control pills, I still had the same heavy flow and pain. So they ask a question, should I get an MRI of the pelvic region? I have pain in my left hip as well as pain in the left side of my upper abdomen. I wonder if I have endometriosis. Let me just leave this on for a few seconds for anybody who's just coming in. And thank you so much if you're watching. Give the video a like and feel free to drop a comment. It's great to have you here. And if you're watching on replay, hi, thank you so much for joining. Don't forget to give the video a like. And of course, drop a question or a comment of your experience around this subject. So, when I see questions like this or comments like this, is really, it's very distressing. I don't know how anyone wouldn't sort of feel, or share the discomfort. By the way, I couldn't find the thumbnail. I couldn't prepare the thumbnail, so I would have shared the thumbnail that she was responding to. But I think it was something like this, or probably a bigger clot than this. But if you don't know what a blood clot is, this is what we're talking about, and we'll be referring to it a little bit more during the video. So that's a blood clot, and she's actually referring to that video where I talked about 16 heavy causes of heavy periods. So if you go and look at it, you will find, the clot size that she was referring to. However, let's go back to the question. So she has, she's making very small blood clots during her periods and a very big clot, bigger than the clot in the thumbnail. So usually when you hear clots, what is the relevance of clots? In itself, okay, having clots during your period is not an abnormal thing. It is the size of the clot that we are concerned about, because the period loss is bleeding. And as blood flows, you might expect a little bit of clotting. So small clots the size of perhaps a little bean or pea. I'm looking around because I was going to put a coin and I forgot to bring it. But small clots like a pea or bean that you see on your sanitary product, like your tampon or your pad. If it's small, if it's not something that happens every single time, that I wouldn't be particularly worried about that. But when somebody is describing something like this, and where they're saying they have small clots during the periods, it sounds as if it's a regular occurrence. And then the one that jumps out, of course, is the very big clots at the end of the period. So, clearly this person is losing a significant amount of blood. And I say significant because I don't really have much more detail than that. And the whole business of how much blood a woman loses is a combination of different things. There are amounts that are just excessive. It is just excessive, whoever the person is. And there are other amounts that is a range, because of course that we're all different. Even within a group of normal healthy women, you will have some who bleed lighter and some who bleed a little bit heavier. The cutoff point, apart from the actual volume of blood being lost, is how much how much is the bleeding affecting their day-to-day lives? How much is it just being a complete mess? How much is it disrupting? That's the word I was looking for. How much is it disrupting their day-to-day activities? So if the amount of blood that a woman loses over her period is within the so-called normal average volume, but it is enough to disrupt her activities, is enough to cause stress on her, then it's a problem. It's a problem that needs to be addressed. But let us then talk about, which is what I was putting in my poll, let us talk about the average volume, or what we call the normal volume of blood a woman loses. So that's why I said it's a practical session. I'm going to put on some gloves because I don't trust myself not to spill things, and I don't trust myself not to accidentally put any blood on my fingers. So let me just put this pair of gloves, and so I'm going to show you. I don't know if I can get it for the camera to see properly. Yeah, okay. Yeah. So I've got 2 jars. You can see properly. Okay, so I've got 2 jars, and whether you're answering on the poll or whether you're answering in the comment section, which do you think is the normal blood flow? Which of these 2 containers, contains the normal amount that you'd expect a woman to bleed every month? And a woman who is healthy, and by healthy I mean she doesn't have any conditions that we have diagnosed, like fibroids or PCOD. Talking about somebody who is not diagnosed with any problem, or hemophilia, where they might have bleeding episodes where you can have heavy bleeding. Which of these do you think is it that one? Is it this one? Or is it this one? What do you think? Let me know your thoughts in the comment section. Anyway, I just wanted to show you that because I'm going to spill the tea. I'm going to spill the bag now, because actually both of them are within the normal. Yeah, remember I said that we're different. Okay, so in this bit I have about 15 to 20 ml of blood in this smaller volume here. Okay, so this is the amount that some women might lose over their 4 or 5 day cycle of menstrual flow. That's about 15-20 ml. In fact, the average actually is 30 ml. That's the accepted normal average. Now, on this side here, it's about 80, 75, 80. This is also anything sort of around 80 can also be accepted as normal. Okay, so some women could have heavier flow, and this is over a 4 or 5 day, average cycle, 4 or 5 day bleed. But when you get above this volume, that is when we begin to say, oh, it's abnormal. So if you are just looking at measuring the volume of blood, anything above 80, technically we say is abnormal. But remember what I said, that we're not just going to be counting the numbers, because some women, would have this 80 ml, and okay, it's a heavy flow, but they sort of manage with it. But for some other ladies, even though this 80 mil, we've said, okay, it's within the normal, it is too much. Now, I know you're looking at this and thinking, 18, this over 5 days doesn't look like much. But, the reason I showed that is so that we can be, what's the word I'm looking for? So that we can be conversant with what these volumes actually mean. And when somebody says that she's passing a blood clot, she's not, she's passing much, much more than just this, liquid that we've talked about. She's passing blood quite rapidly, so quickly, and in a large amount that the blood is congealing, forming clots. So just for us to have some fun. Now, if your blood loss is about 20 mils over 5 days, okay, so that means on average it should be about 5 mil. So let me use one of these home syringes. So 5 mils per day. So if you are answering the poll, or if you haven't answered the poll, I've just given you the answer. I've just giving you expo. We used to call it back those days in school. Giving you the expo. That's the answer. So this is 5 mils. So that's what somebody who, on average, if their average flow is 20 mil in a month, for their menstrual cycle, and they do 5 days per month. This is sort of on average, they might do between 4 and 5 mil per day. Okay. Fresh sanitary products. So I'm just going to apply some and see how much that looks like. Now, it's not going to be, I'm sorry I can't do it because it's going to just drip I'm sure it'll just drip. Oh my goodness. This is the mess I didn't want to make. This is the mess. This is why I've got these gloves on, and this is the mess I just didn't want to make. I don't know if you guys can see what I'm trying to do. Let me move a little bit. Oh my gosh, oh my gosh, oh my gosh. Okay, let's do this quickly. So do you know what? You can see how, and of course, women change tampons or pads. You don't just wear one during the day. But that's 5 mil. That's just 5 mil, and you can see how much it is. Women can actually experience even heavier bleeding during the course of their 5-day bleed. And that 20 mil really is quite small, and women can go from 20 to 80. Like I've said, that is normal. We're all different. Okay, but I think it's sort of useful to have that, this is what it might look like. For somebody who is not bleeding very heavily. For somebody, of course, who has very heavy bleeding, now they would soak their towels or their pads, they will soak them. They would have things like blood clots. They could also flood, which is when the blood seeps past their towels, past their underwear, past their clothing, into bedding, into bed sheets, mattresses. Now, of course, that's not normal. And it's important that we're saying this because some people still think that, it runs in the family. So I think I've put so like 10 mils. So I've really soaked this. Okay, so that we're seeing the kind of volumes that the things look like when it comes to the sanitary products. So flooding is going into your clothes, into your bed, into the chairs, and all. That's not normal. It's not something that you should ignore. You should really look at it. And I wanted to sort of give us an impression of what the volumes look like and what they would appear like on the towels, on the pads, on the products. Okay. So let's go back to this individual. I think we've established the fact that discussing having a large clot, that's not normal. So she goes on to say, I have very heavy periods and pain on all the days of the period that I have to take 12 painkillers in 4 days. So having to take painkillers to a large amount. Now, there is something called dysmenorrhea that those of you who are regulars on the channel, you have talked about this before. Painful periods that women can have. There's primary and secondary dysmenorrhea. I also have a video. I'm not going to spend too much time on that. Secondary dysmenorrhea is dysmenorrhea or painful periods because of an abnormality, for example, fibroids, or endometriosis. While for primary dysmenorrhea, we think it's because of hormone imbalance, and the hormone or the chemical that's responsible at that point is your womb producing more of something called prostaglandin, which is what causes the womb muscle to contract more and causes the pain. And that may be something that happens more when you first start, or during the first year or 18 months of a woman's or girl's cycle. So as she comes into puberty and starts having periods, there's still a bit of hormone imbalance because the body begins to regulate itself. So they may experience painful periods. Simply because of that. Not because it's the physiology, is the body trying to get into that, preparing for its reproductive phase over the next so many years before menopause happens. So that's primary versus secondary dysmenorrhea. But this lady says, I have very heavy periods, pain on all the days. So she's having very painful periods. This is not normal, having to take 12 painkillers in 4 days, because some women can have painful periods. They might need to have a couple of pain medicines, and then it settles down. So they may have a bit of cramping and it settles down. They might need to use a water bottle and it settles down, but it doesn't get them down. They can't do anything. The pain is just so excruciating, they can't move. That is not normal. Okay, what else she says? I had an ultrasound. So the ultrasound told us that she has a hormone imbalance problem. And so we have some understanding as to why she may be having abnormal periods. And so they did what we would usually do when faced with a situation like this. So we would start birth control tablets, because we're looking at trying to, I'm so sorry about the light. I don't know why it is going up, and I noticed that it's sort of dimming, and I'm not doing anything, but it seems to be doing that. Maybe it's because I'm moving about. So please excuse me. Okay. So, yes, in order to try and regulate the periods, or to bring about some balance, they would, your doctors might prescribe birth control pills, because by so doing, there's a chance to switch off or to put to sleep your own hormones, your own ovarian activity, or your own ovaries, for temporarily, just switch them off, let them calm down, so that you start having bleeds, but they are regular because they are coming from an outside source, that is the pill that you're taking. But this lady, that wasn't her experience, and that's not unusual, to be honest with you. It's not going to work for everybody. Some people it doesn't work. And she said, sadly, I was on birth control for 3 months and the pain didn't go away. So her pain didn't get better. And the thing about birth control pills, which is again another reason why it's used for problem with heavy periods, when you want to control heavy painful periods using birth control, it makes the bleeding lighter, and not only that, the pain also controls the pain. So for those 2 reasons, but clearly didn't have any effect for her, because even after using the pills for 3 months, which is a good amount of time to see whether they've worked or not, so on average 3 months is sensible, when she stopped them, she still had heavy flow and pain. So that didn't work. And now she's asking, should I get an MRI of the pelvic region? I have pain in my left hip as well as pain in the left side of my upper abdomen. I wonder if I have endometriosis. I think that's a very, this concern about endometriosis. It suggests to me that this is somebody at least who's heard, who's aware, which is good, because that's what we want. We want to be aware of possibilities, not accept, and for us to be aware of them pretty early, because if it is endometriosis, then getting diagnosis early and getting treatment started sooner than later is better, is preferred. Now, in terms of what tests that she needs to do, she needs to have a sit down with her specialists. So I presume that this is somebody who should be under the care of a gynecologist, because we haven't gotten to the bottom of this problem. Her GP or family doctor may have been the person that started her on the birth control medicine, and it didn't work. And then they did the scan and they found this, and she's still having this. She should go back. She should really go back to the doctor and say, no, it's not getting better. I come across people who maybe 18 months or 12 months down the line, they've been having very heavy periods, and you say, oh, how long have you had this problem? It's been going on for so and so time. Have you seen anybody about it? Yes, I saw my GP and they did this and they did that, but it didn't work. And then they pause, and I'm waiting to hear, okay, what next? And I don't know, sometimes they didn't go back, and I'm like, okay, why? there are different reasons, but the point I'm trying to make is, please, if it didn't work, go back. If it didn't work, please go back to your clinician. And if you don't have confidence in a particular person, please seek a second opinion, or go back and keep looking until, we answer. Because I think it's important that you're getting a referral to a specialist to have a look and decide what are the next steps. Of course, an MRI scan, yeah, that's one of the possible investigations. What about a biopsy? What about a laparoscopy? So there are different things. And the issue now is really, you should sit down with somebody face to face, somebody who knows all your medical background and can have a look at your history, your own personal history, and any procedures you've had in the past. Have you been pregnant before? Have you had any, sort of procedures like a medical termination, any surgical procedures? Questions that we don't, answers that we don't have the access to here, to be able to say yes or no. And that's why I put the disclaimer at the beginning of this this conversation. Are you on any medication? Is there a family history of any conditions that might be relevant to this discussion? So this is what I think in terms of how we could potentially look at this situation. The necessary examination, physical examination, the necessary blood tests to make sure that there are no abnormalities in terms of other hormones, looking at more scans, looking at the womb lining, which is why my last video will be quite useful here, because one of the things we talked about is irregular painful periods being a feature of a thickened womb lining. I'm not saying that's what she has here. I'm just saying it's one of the things that you want to, you also want to look for. And I know somebody will look at, she said she has pain in her left hip and her left side. And she's mentioning endometriosis. Yeah, because if she has endometriosis patches, of course, that endometriosis, and by the way, I also have an endometriosis playlist on the channel. So please, if you're curious about this condition and asking questions around how it affects this or the other, how to differentiate it from this or that, I do have conversations around that. Please check out my endometriosis playlist. But yeah, when you have womb, the inner lining of the womb turning up where it shouldn't. So if it happens on the bowel, for example, or it happens somewhere in the pelvis, then, you could have pain in those areas, bleeding from those areas. So that may be what she is experiencing. And it wouldn't show up on a scan. You wouldn't see that on a scan. She's had the ultrasound and it didn't mention if she had fibroids. So presumably they didn't see any fibroids. She didn't comment on that. But those are some of the things that we're thinking about. Let me know what you guys think. Let me know about what's your experience. Is it something similar? Are there any treatments that you think, oh, well, why did they try this or the other, and so on? Have a think about that, and don't forget to have a look at the poll. I'm just going to check on it in a moment, but please have a look at that and let me know what you think. Let me take a quick break and I'll be back with you now.
Hi, I'm Dr. Sylvia. I'm so excited you're here. In this video, you'll get excellent health tips that will make a real difference. But that's not all. I also create personalized guides, tools, and plans tailored to your specific needs. These resources will help you reach your goals faster and more effectively. Don't miss out on your free copies. Check out the links in the description box below. Before you watch this video, please like and subscribe to the channel so we can continue this health journey together. So, let's get started. I'll see you in the rest of the video.
Okay, welcome back. So we've dealt with one of those questions that I got over the last few days, and I really wanted to have a conversation because I think the conversation here will be quite useful, not just to the person asking, but to other people wanting to maybe dealing with something similar. So let us look at the second question, which is that was a bit of a longer one, and I think there's a little bit more conversation. And this is the person that provoked the title where I said, are doctors not doing enough? So let's read and see what this lady, and I didn't say thank you to the other person. Thank you so much for putting this on the channel and just sharing. I know you're making an inquiry, but you know what? Just by putting this out there, you're helping somebody else, because as we look into these things, there'll be somebody, I know there'll be somebody who will look at this, watch this, and say, oh my goodness, I did not know. And just because of that, they'll go and seek help. So thank you. Thank you so much for what you do by sharing these questions. Much, much appreciated. So this next one is, I have had extreme pain during my periods since I was 11 years old. Okay, so I've talked about dysmenorrhea just a few moments ago. We talked about primary dysmenorrhea, secondary dysmenorrhea, and the quick way to remember the difference is both of them mean painful periods, but the primary versus secondary is referring to the cause. And so primary will be referring to when there isn't any obvious, we say no obvious abnormality within the body or within the womb responsible for causing the painful periods, different from secondary, where there is some abnormality, for example, fibroids or endometriosis. With primary, what you tend to find is there is an abnormal, most likely an abnormal production of the prostaglandins that causes the wombs to contract more than they would normally do, which is what leads to the pain. But with secondary, where you have problems like fibroids, where there are growths in the womb and it's altering the structure of the womb, that's what's causing the irregular, painful bleeding experience. So that's how those two are different. So we've looked at dysmenorrhea. That's what it means. They can have different causes. Primary tends to be more common as girls enter puberty, get into their teens. That's when you tend to see more of primary dysmenorrhea. And like I said, I do have a video on the subject. If you want to learn more, please have a look on my, I think it's Menstrual Matters playlist, but I hope I remember to put a link in the description box once we're done with this video. So let's continue reading. So extreme pain during my period since I was 11 years old. So presumably we're dealing with primary, because, women can have, or girls can have really, really uncomfortable, dreadful periods as they start, as they enter into the first 1 or 2 years. So from puberty, as the period starts, after a few months, they start to experience really painful cramps. And it looks like this is what happened with this lady. So the initial thought would be that, oh, this looks like primary dysmenorrhea. She says, I got my period when I was 10. The clotting started in grade 7. So quite early on, the periods got really heavy, because that's what clotting means. Where's my clotting? Let's put our clotting picture up again. That's what it means. That's when clots are happening. I said already at the beginning that passing a blood clot per se, when you have your period, maybe just once or twice, a small one size of a pea, maybe a third or half the size of this, just once, I wouldn't worry. For some people pass a little bit heavier and it's not abnormal per se. It's if it's happening every single time, as if it's every single day, as if it's very large clots, because that is indicating to us that your bleeding is very heavy. That's the meaning of passing clots. So hers started in grade 7, and she says they've always been huge, the size of apples or more, every month. Okay, so this is where I said this was a practical session. So just imagine this. I mean, you saw the picture. Let's bring that picture again. So we're going to be, okay, look at this. This is not the size, what you're seeing on the screen is not the size of an apple. So this is still tolerable. Imagine seeing this on your towel or menstrual cup, or you're changing or having a bath, and this size of a clot drops out of you. Imagine, I hope this apple is, imagine that. How awful, how scary, what on earth is going on? And she said grade 7, so she's still a teen, she's still in school, guys, still in school. Okay, let's read. They've always been huge, size of every month. So they told me to take birth control pills. So there is us, the doctors, told me to take birth control pills, and I've explained, but just in case you weren't here, and I've said this is usually because on average you don't have these conditions like fibroids or endometriosis. These are not conditions that are common in teen age groups. They are more often diagnosed in older ladies. So as you go into your mid 20s, 30s, mid 30s, these are the, so it's not something that you'd expect to find in somebody in their teen years. And I know, that said, some people say, no, 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 I understand. But I have come across in research, and I don't know where I've kept that study, but a 16-year-old with fibroids, and it was just that her bleeding was horrendous. It was just mad. It was really crazy before they eventually went on to do a scan and then discovered that this poor girl had fibroids. So it's not as if it's impossible, it's just that it's not common. And when faced with a young person experiencing that, you look at different options. It's not really, I mean, I don't agree with just sticking somebody on hormones because, and I don't know if they discussed anything else, because there are other options different from hormones, medical, that's speaking medically now. For example, using for both painful periods, using something like non-steroidal anti-inflammatory drugs like ibuprofen to control the pain or the bleeding. So that's something that's non-hormonal and can be effective, but for very heavy bleeding, not so much. So it may be that they tried that and it didn't do anything. There are other drugs, again, that are not hormonal. For example, tranexamic acid, which is something that can help to prevent blood clots from dissolving or from breaking down. And by so doing, they reduce bleeding. That is not a hormone, so that may be something many women are prescribed that for heavy periods, but we don't know. We don't know. What we know is what we're told in this instance, and that was that she was given birth control pills. Presumably, those didn't work either, because the next thing she tells us is, I had imaging done, so that means she had a scan. She had, I'm glad that things were being done. Of course, clearly we don't know how quickly things were moving. We don't know, was this stuff did she wait a few weeks or a few months, or was it years? I don't know the pace at which it all happened, but clearly there is some work done. So kudos to her for pushing and demanding, and no, this problem has not gone away. I need to work out what's going on, and continue to put pressure where it needed. And to whoever is looking after her, although as you see at the end, she's not thrilled. So she had imaging done. And so presumably, because she didn't tell us, imaging did not reveal anything, presumably. I don't know. I don't like making assumptions, but I don't know. She doesn't tell us. And then she says she had a D&C done. And I think that's D and C, dilatation and curettage, which is a procedure where it's like a scraping. I know that's a harsh word, isn't it? It's like just trying to treat or to remove a little bit of the inner womb lining. It's used for different reasons, okay? One of them, I'm not going to go too much into that, but one of them happens to be if somebody has irregular bleeding. It can be a procedure that you perform to try and see if you can reduce the bulk of a thickened lining, and to see if that would help to settle the bleeding down. So I think this is what she had, and it's not a complicated procedure. You might be, you might be under anesthesia, and then the doctor will introduce, of course, without any pain. So of course under anesthesia, which could be local, general, depending on whatever the scenario is. But they will introduce some little tubes, if I can use that term, called dilators, just to widen the entrance of the cervix a little bit, and then introduce the instrument that they want to use to manage or to shed that little bit of the womb lining. Sometimes it's like a vacuum or something to suck out a bit of the womb lining, or sometimes it's an instrument that can scrape away at the lining, because that's the older one. But those are the different instruments that are used, and the objective is to try to remove excess lining in the hope that after the healing, the bleeding reduces from what it used to be. So that's what she says she had here, and that also did not help. Okay, so now we come to where things are really it's a real shame. And you guys know that part of the things I like to do on this channel, part of the thing what I think is really important for us to be here in this platform is to advocate for ourselves and to call out rubbish when we see it, and not to accept gaslighting, because that's just ridiculous. She says, and I am always told to suck it up. The pain is incredible. And that's sad. It's sad and it's annoying, because if somebody had kidney stones, which are that's proper pain, proper pain. I mean, that's just one example of really bad pains. They wouldn't tell you to suck it up. This is really severe pain that this individual is going through. We all have different pain thresholds. It's not for me to be saying that your pain is to be downplaying your pain, even though we'll try to assess it to be able to work out, okay, how bad is it? But it is her experience, and it's unfair that she's been told to suck it up. She's experiencing bad pain, and being told to endure it as if everybody's tired of the situation. I'm sure she is more than tired of the situation, but she's going to live with it. Anyway, let's go on. She said she bled for 9 months solid, and no doctor would do anything until my hemoglobin was low. I was so low I needed more blood. Then they did another surgery to stop the bleeding. So, this is, of course, it's clear that anybody who is losing that amount of blood, she will eventually at some point end up anemic. She says she had that kind of bleeding for 9 months. We don't know how long she was bleeding for. That's another thing. We don't know whether her periods were 10 days, 12, we don't know, but she was losing a lot of blood, and doing that regularly for 9 months. And of course, her hemoglobin, of course, is going to be dropping, unless somebody is thinking ahead, apart from working out what's causing it, but saying, look, you need to be topped up with either iron tablets or, some kind of other measure to control the bleeding. So she could have well perhaps collapsed from very low hemoglobin, or whatever it is, because if it's gotten to the point where they need to transfuse you, that's very, very low hemoglobin. Right, so we're nearly done here. So they did another surgery to stop the bleeding, and despite that, it still happens, and I'm in pain every day. And of course, the most heart wrenching of this comment is, I wish doctors were trained how to treat women, because this is ridiculous. And that's why I put in the question, in the title, are doctors not doing enough? Are we doing enough? Are we not doing enough? I mean, clearly, of course, there are doctors who go above and beyond, provide the great care to their patients, and help make a real difference. And I'm just sad that some of us do have this kind of experience where that's not the case. They're still struggling, feel as if they're not being listened to or heard, or being disregarded, and that's just the pain of it. So it's difficult to say. This one, quite a few things have been done. And we don't have enough information to sort of work out what we're dealing with. Did she have a biopsy looking at her womb lining? Has she had a laparoscopy? Looking into her pelvis? Has she had a hysteroscopy looking into the womb itself? Different things, presumably, I don't know, but these are some of the things that you do trying to manage this condition. How old is she? That's a good question. How old is she? Because being able to bear children is a key critical issue that will help you determine what are you going to do for treatment. So it's a whole conversation with a practitioner that she trusts, that has her back, that is interested in helping to solve the problem. And the reason I put it up here was to showcase the challenges that women can have when it comes to dealing with periods, when it comes to just how to manage this situation that one has to live with, considering that a woman will have monthly bleeding from an average age of 10, 11, up until maybe her late 40s or 50s. So if it is riddled, unless she's pregnant, if she's riddled with such distress and such struggling so much, how does she focus on work? How is she productive? How can she contribute to society going through all these things? Okay, guys, so I'll let you chew on that. Let me take a quick break. And then, like I said, somebody just shot in one question as I was about to go live. And I just want to have a quick look at it and see what we think about it. I'll be back in 2 ticks.
Hi, I'm Dr. Sylvia. I'm so excited you're here. In this video, you'll get excellent health tips that will make a real difference. But that's not all. I also create personalized guides, tools, and plans tailored to your specific needs. These resources will help you reach your goals faster and more effectively. Don't miss out on your free copies. Check out the links in the description box below. Before you watch this video, please like and subscribe to the channel so we can continue this health journey together. So, let's get started. I'll see you in the rest of the video. Hi.
Whew, right. Okay. So, yeah, I didn't have the chance to prepare that question. So let me just put it on the, let's put it on one of the banners and then, okay, let me just put, it's not a very long one. So let me just put, I hope you can read it. Is it going to show? It's too long for the banner. Okay. I'll put what I can and then I'll just read the rest of it. Okay, let me just, yeah. Okay, it's a bit long, so I'll read the rest of it. So, oh, it just missed out one word, so we're good. It says, since last year, December, after having a missed abortion, I'm having heavy periods with black big clots. I went to the doctor and they said it's imbalanced hormones, and I have periods since that till now. So, let's keep this on for a moment. So, she had a procedure after having a missed abortion. So she had, well, I don't know actually if she had a procedure. I don't know exactly what happened. So I presume she would have had a scan. I presume she would have had bloods for them to make the diagnosis. Okay. I don't know if she had a procedure. And by procedure, I don't know if they tried to do anything because I don't know how many weeks she was at the time of this abortion. So how it was treated, we don't know. And that will be useful information in terms of trying to work out why she's having heavy periods. It'll be good to know what were her periods like before she became pregnant. Other things that will be useful to know are, the rest of her medical background. Useful to do an examination, physical examination, do some blood tests. Well, anyway, she tells us she's having heavy periods with black big clots. I mean, the relevance of this is when, again, the presence of clots and big ones is that you're losing a lot of blood. There's a lot of blood flowing quite quickly, which then congeals and it would look darker. So if it was quite recent, if it was, oh, this problem just started a few days ago or in the last couple of weeks, and the period or when it comes out of of her is offensive and black, I'd be worried about an infection. But in this instance where it's been December till now, what we're saying 9 months, I'm not seeing an infection picture here. It's been going on too long. At least not an acute infection like a PID. Let me correct myself. Not an acute infection like a PID or septic kind of thing where you'd have a period or discharge from the vagina that is offensive or that looks a very, very odd color, like passing black big clots. I don't think that's what we're dealing with here. So she went to the doctor and they said it's imbalanced hormones. Okay, I'm not really sure what that means. Okay, so have they done what I mean by that is, have they done any tests? Have they examined her? Have they done any tests to work out? Have they planned to scan her to look at the womb lining? So this we shouldn't just leave this like this. It's been going on for 8 months or 9 months now. That's a long time. That's a long time. So really, she should go back. She should sit down. No, this is not okay. So imbalanced hormones. How long am I supposed to experience this? Shouldn't these hormones that became imbalanced when I was pregnant, shouldn't they have recovered? Of course, they should have recovered. So we need to be thinking of something else. There has to be something else behind this. So I don't accept that it is just imbalanced hormones. Well, clearly, I don't have too much information, so I'm simply going by what we have here. But I think that it would be useful to sit down with her practitioner. If she's able to access a gynecologist, then she needs to sit down with them so that she goes through a proper, thorough history to know the circumstance, how was the age of the pregnancy that she lost, the missed abortion that happened. Was there any procedure? Usually there might not be because it was a missed abortion. So it implies that there was a pregnancy and then the baby died. And she didn't realize, actually, she didn't even know, which is how we get the term missed. It's only if you start to have any bleeding issues or persistent pain that you then go and start doing scans and all that. So probably nothing happened at that point. But subsequently, she started to have abnormal periods. So could something have changed in terms of her womb lining? Could she have developed could she have developed some other condition? When they say imbalanced hormones, what are they referring to? Does she have PCOS? Questions, questions, questions. These are the kind of things that one would need to. It's not something that you can, and I really advise against, let's just take this tablet to make it all better without really knowing what the cause is. And even though that said, I agree that when it comes to young girls and teens who have really very, very heavy periods, at least here in the UK that I practice, one of the accepted measures of dealing with this problem is to put them on a course of birth control pills. But it is supposed to be for a short period of time. You bring them back and assess, is it helping? Is it making any difference? And you begin to, what's the word now? You begin to educate them to make sure that this is a short-term measure. I would really like an opportunity for them to come off the birth control pill and see if what their natural cycle, if it's, come back to or become a pattern that they can live with. So not heavy bleeding, but not just to stick someone on birth control pills for years and just assume that, they're fine, they're happy with it because they need contraception, because that's an assumption I think that some of us make. So there you go. There you go. Let me say big thank you to everyone who sent in a question. Much appreciated. I think we've had a bit of a discussion around them. And again, I like to remind us that we can't give medical advice, but we can sort of have a look into some of the details that you bring in with a view of just learning, educating ourselves, sharing experiences. And I'm so glad that you've chosen to spend a little bit of your Sunday with me. Thank you so much for doing that. Please keep an eye on the channel for a lot of great things coming out later in the week. I've got 2 or 3 videos coming out later on in this week. Can't remember their titles at this point, but there'll be something that you'll find useful, I promise. So please make sure that if you're not already, please subscribe and make sure you turn on the notification bell. So you'll know when our new videos are live. And let me know what your thoughts are, any comments on the topic that we've looked at today. I thought I would be able to look at the poll. So if you've participated in the poll, thank you so much. Let me see if I can, I don't know if I can pull it up here. If you have, thank you so much for responding to it. I just want to see without disrupting anything. Okay, let's see. Okay, so we've got some so to the poll, thank you for everyone who responded. Let me just put that. So we had, and even without giving the answer away, we had 62% saying 10 to 20 meals daily. Well, so, and then it was 25% saying 5 to 6 meals daily. So that 25%, you guys got it right, because on average, the volume is 30 mils. That is the average volume for a healthy person. But like I said, a normal healthy person can bleed up to 80 mils. So up to 80 mils, but anything above 80 mils is abnormal. But I always say to you, let's not get bogged down by just the volumes. Please remember, if it's something that is disruptive, even if it is 50 mils or 40 mils in a cycle, if it's something that's disruptive, just causing stress and disrupting somebody's life, just can't go to school, can't do whatever she's supposed to do, just getting bogged down with this symptom and the bleeding is intolerable, then it's something that we need to look into. So thank you so much. I'll just end the poll here. Appreciate you guys for going ahead with it, and thank you so much for being a great audience. All right, guys. Thank you so much for watching. I will see you again next time with another interesting topic. And of course, if you have something that you'd like me to look into, absolutely welcome to share it with me. And I'll see you later. Have fun. Great week. Bye.